Jessica grew up in Flower Mound in Louisville, so she had no trouble finding this building. And graduated from Texas Tech in '04 with a Bachelor of Arts in Poli-Sci, and she currently is working on her master's degree, which she got permission to skip class tonight to be with us. Her degree, her master's is going to be in public administration programs, and she's getting that at UNT. She's been with PPNT for more than 4 years and now resides in Roanoke. So please welcome to Jessica Leinwand.
See if I can grab all my notes. Yes, thank you. And thank you, Diane. That was very kind of you. So many kind words, and I'm a little bit speechless at that. Thank you very much, and yes, thank you for having me. I'm very glad to be here. I'm so excited to be invited by your group to talk about the issues that are important to our agency and to women of the North Texas community. And I just want to, of course, just reemphasize that I am going to be sticking around afterwards and answering all questions, so if we could be so kind as to hold questions till the end. I promise I will get to as many as I possibly can. I can't promise that I'll get to all of them, but I'll get to as many as I possibly can, and I'll be happy to answer as many even after the meeting. So anyways, let me go ahead and start off. As Diane said, yes, I'm the online community advocate for Planned Parenthood of North Texas. Mainly, my position there and my department is responsible for educating the community, such as members as yourself, about reproductive health issues. This, of course, would seem like a daunting task, but you would be actually surprised about how, A, very little people know, and B, how very interested and excited they are to hear about these issues, to hear about things that are not just related to issues of choice when it comes to pregnancy, but they're also interested in knowing information about family planning access, information about sex education, what our kids are learning in school, and particularly what our kids are not learning in school. Just to give you a little bit of background real quick, because I was asked to come here tonight to speak on what Planned Parenthood is about, what our mission is, and what we stand for here in the North Texas community. We are a nonprofit organization that offers voluntary family planning services to all who need it in the North Texas community. We span a 57-county service area, and we have 29 health centers within, I believe, 13 counties here in the North Texas area. Again, I want to stress that we do voluntary family planning, so of course anybody who comes into us and asks for our services, we will not turn them away. We are the 6th largest affiliate in the nation, which is a pretty wonderful feat if you ask me. And we are #1 in Texas. We are the first affiliate in Texas according to patient size. So we see the most patients in the state of Texas than any other affiliate. And actually, on average, we serve more than about 90,000 patients a year through our 29 health centers. And that's a huge undertaking, and yet we are able to pull it off, I think, very effortlessly. And just to add real quick, we are also celebrating our 75th anniversary this year. So I'm very proud to report that. And our agency is mainly made up of 3 facets that control everything that we do and play into everything that we do here in the community. One is, of course, medical services, access to our health centers through, and our services, including services that do include pregnancy testing and non-directive counseling, access to contraception and well woman exams, including in those exams include breast exams, pelvic exams, Pap tests. We also do STI testing and treatment. We do cryotherapy, which has to do with abnormal cervical cells and cervical cancer. Cryotherapy, LEAP, which is a procedure to remove those cells, and colposcopy, colposcopy. And also as well, just a whole myriad of services that we offer, including, let me go ahead and add in there that we also offer social service referrals as needed. We offer emergency contraception, as well as basic reproductive and general health screenings for things like high blood pressure, cholesterol, diabetes. Also, we screen for urinary tract infections. So we range the gamut on our services, and we are very involved in the community in helping women and men make responsible decisions about sexual health. We're involved in helping them to keep their health, maintain it, or improve their health, and therefore they can take better care of their families. So the three facets, of course, like I said, medical services, education. We have a wonderful education department that works on HIV testing and treatment within the community, as well as educating at-risk populations. We have community educators that go to various social service groups, and also religious organizations, PTAs, a number of different organizations to talk about responsible sexual health programs. And the last facet is advocacy, which is actually where I come into play. Our advocacy programs and our advocacy work is undertaken by the Public Affairs Department, which is my department. And what it is to educate, like I said, educate supporters like yourselves about the importance of standing up for and protecting reproductive rights and reproductive health care access in the state of Texas. And hopefully my presentation will make that a little bit more clear as to why that is important. I did want to also add in real quick about Planned Parenthood as an agency. Planned Parenthood of North Texas Incorporated does not provide abortions. We are solely about family planning. Abortion care is provided by a separate nonprofit organization that has its own administrative and financial section, and we are separated from them according to state law. So I just want to go ahead and make that clear. We are solely the family planning organization. So let me go on, and as Diane said when she was introducing me, mainly we are about not only educating supporters like yourselves, but also educating our elected officials about reproductive health care access and about the importance of responsible health care and responsible decision making for people of all ages, not just adults like you and me. And that's been a very big facet of our work as of late, especially in regards to sex education, and it will continue to be a very big issue in the years to come. So just to give you a little bit of an overview, a generalized view of what women are facing here in Texas when it comes to access to reproductive health care and family planning. And it usually surprises a couple of people to know about this, but where exactly we fall into the spectrum of things. Texas has the 43rd lowest rate of provision for contraceptive services to women, which means that we are 43rd in the nation for being able to get contraceptives to women who both qualify for and need them. We are the 44th lowest in the nation for women receiving prenatal care. Yes, we are. And we actually have the highest rate of uninsured people in the state, other than the highest uninsured rate of any other state. At, I believe it's 24.4% of people in the state of Texas are uninsured. We have one of the highest rates of teen pregnancy in the nation for adolescents ages 15 to 19. We have one of the highest rates of births to adolescents ages 15 to 19. And we actually have the highest rate of repeat teen births to adolescents ages 15 to 19, which means that women under the age of 18 are having one child before they turn 18 and then having a subsequent child before they turn 18. So that's what we're facing. There are nearly 1.4 million women in the state of Texas who qualify for but do not have access to subsidized family planning health care. They qualify for it. They're not making enough money to afford private health care insurance. They're qualified for specialized programs like Medicaid and others, Title X family planning, which I'll talk about here in just a moment. They qualify for that, but they simply don't have the access because there's a shortage of providers, or they simply do not know that these services are out here. And also as well, I want to add that sexual health in Texas does not fare much, it does not fare well either. Texas does not require schools to provide sexuality education to our young people. It is actually in the law that schools they're not required to teach them anything. And actually, as a matter of fact, 2% of school districts in the state of Texas do not teach it at all. And that is from a report compiled by the Texas Freedom Network. I highly encourage y'all to look that up after the meeting. If you want to go on the web, type in Texas Freedom Network, there's a report, Just Say Don't Know, and it lays out how all the ISDs in Texas actually, where they range on sexuality education. If a school does decide to teach sexuality education, the law states that it must teach abstinence, but it is not required, the school district is not required to provide any information in turn about contraception, including condom use. So we're telling kids to just say no, just say no, just say no, but we're not telling them how they need to protect themselves and why it's important for them to protect themselves if they do decide to become sexually active. Excuse me. I'm getting a little bit tongue-tied up here. And also as well, that's the same thing that goes for sexually transmitted infection education, STI education. So some school districts decide to teach about teen pregnancy prevention, others decide to teach about sexually transmitted infection prevention. They are not required to teach about contraceptive use, including condoms. And as we all know, condoms are the only way for sexually active people to protect themselves against both pregnancy and STIs. So moving on, that's kind of what we're facing here. It is a little bit of a tough environment, but it's not impossible to work within. It's just that it takes a lot of tenacity for us to, educate community members like yourself and our elected officials about the need for this access and the need for this information. So I was also in asking to come up here, I was told that y'all would like to have some information on what is the current situation here of access to reproductive health care in the state of Texas. So I've given you a little bit of a general overview. I've told you what Planned Parenthood is about. Now I'd like to kind of show you what we're facing with regards to the political environment here and what we're facing at the state level when it comes to public policy and program initiatives.